Tuberculosis is a scar on the face of this earth. It's a matter of shame for all of us, for all right-thinking individuals, simply because tuberculosis is a treatable disease. Yet, there are more than 8 million people in the world today who need treatment. In India, TB has become an epidemic. Every minute, an Indian dies of the disease. We need centers, more and more TB treatment centers, just like this center run in a beauty parlor. But tuberculosis is not just a disease. It's a socio-economic problem. People lose their jobs, women and children thrown out of families, out of schools. And the kind of discrimination they have to face, the TB patients are facing, it's horrifying. In our country, there's such a lot of social stigma attached to TB, and so is true of other countries. And this is why we need so many people. We need all hands on deck. And we in Operation ASHA have solved the last mile problem. In TB treatment, the medicines are there for free, the public hospitals are there, the TB specialists are there. What is missing is a delivery channel, a place from where patients can get their medicines at a time, convenient to them, and near their houses, so nobody needs to know, the privacy is maintained, no one needs to miss their wages in order to take TB treatment. And this is one such center in a beauty parlor and a tailor's shop. And we have this lady who's doing stitching, she's selling bindi and chudis and so many articles of beauty, and her business is booming. She gets a lot of respect from the community, and we are very happy, we are lucky to have her with us today. We are also lucky to have a friend, Jack McCambridge, who's come all the way from Chicago. Jack is very highly qualified. He's from Harvard, health expert for the largest microfinance organization in our country. Have you seen our work and what do you think about it, Jack?
I think after 9 months of working with some of our customers in rural Orissa and rural Andhra Pradesh and Karnataka, the one constant that we've seen for microfinance is it's not that the money doesn't exist or the people able to give the money, but people aren't reaching our members at their doorstep and able to include them financially through giving loans because people haven't figured out a way to make it inexpensive and personal and in a way that's respectful for our members. And so when you talk about what's successful in your model with using people in the community in a way that doesn't create unnecessary infrastructure costs, it's exactly what's worked for SKS, but in an area that's much more challenging, that's public health.
Yes, and public health is a challenge, and TB is one of the biggest health crises confronting our country today. And this is why our work is in the community. We are serving the community and utilizing the community. So Jack, this is what a TB treatment center is all about. We have these boxes of medicines, the names, the numbers, and the date of starting, everything is written. Vijay is our counselor for the center. Santosh is our TB treatment provider. She lives here. She's available from 6 in the morning till 9 at night. In fact, she says patients can come anytime. I'll open the door and give them the medicine. Rani is a patient. Now this is Rani's box, and this is how dots is given. The entire strip is taken out, given to Rani, and Rani has to swallow it in the presence of the provider. And this finishes our work for today. The empty strip is kept back in the box so that it can be seen by the Government of India and the WHO officials. And this is another important part of our model. I think, Jack, you've understood the concept. You can see these folders. They have been given by the revised RNTSP program. We have these boxes of medicines, color-coded boxes, to take care of the side effects, and these are a perfect camouflage because not only they take care of the side effects of the medicines in the patients, anyone in the community who needs a medicine for say vomiting or a cough syrup or paracetamol, they can come and take the medicines. So the center is not really known as a TB treatment center, it's known as a community health center. Right. So this ensures that there is no social stigma. So this is DOTS, and it's not just a disease we are tackling. It's a war we are fighting, a war against pestilence and disease and a horrific human rights violation. All those who are listening to me today, you're all part of this program, you're all part of this movement, and I want you to contribute. It costs $110 a month to run a center like this, in which we treat more than 100 patients every year. And you can contribute, you can support the center for 1 month, 6 months, as much as you like. Thank you.